Chris Walker, Preparedness Coordinator for the Hamilton County Health Department, joins me. Good afternoon, sir.
Good afternoon.
Been a while since we did this. We were hoping not to have to do it anytime soon, but there's been an uptick in cases over the past couple of weeks. What can you tell us about that? What can you attribute that to?
There has been an uptick of late, and I think there's a couple of factors at play. We've been moving through our back on track Indiana steps and opening up more and more activities. We recently just came out of a holiday weekend with the 4th of July. But when we look at the data, what we see is there's been a pretty large spike in the 19 or 20 to 39-year-old demographic. They count for almost a third of all positive cases in Hamilton County at this point right now. So that group has really caught up to the other age groups that we were tracking in this.
What do you attribute that to? What are they doing or not doing that is affecting these numbers?
It's hard to say because I'm not in that age group, but we suspect that we're not wearing our masks, we're not social distancing properly. We do know with the holiday that there have been a lot of gatherings that have been going on with the nice weather. I mean, it is summer season. All the kids are home from college and from school and everywhere else, so there are a lot more opportunities for them to engage in communal settings.
So Marion County is requiring people to wear masks, and a lot of people ask us if Hamilton County Health Board might make the same requirement. What's their stance?
Last week, the Board of Health met for their regular quarterly meeting, and the message of wearing masks was brought up. And they determined that we would strongly recommend as a health department and as the Board of Health to wear masks. The reason they did not mandate or require it was because there's no enforcement arm to making it a requirement. So they felt like that was not the proper verbiage to use for mask use. However, when the people are inside in public settings, when they're outside and they cannot social distance, we still strongly feel that masks should be worn whenever possible.
How is testing coming along? I know we've had the OptumServe folks here for a couple months now. What's happening in the coming months?
So we've been doing really well with our Optum site. We have been testing approximately 100 people a day since we started back in the middle of May. They've really been knocking out of the park. We did move from Grand Park to 400 Lafayette Road in Noblesville, which is just north of Riverview Hospital. And we are looking at putting on our own testing capability in the coming months. We're working on partnerships with healthcare providers in the community, as well as possible partnerships with other departments at the municipal level as well. And we hope to have a more concrete plan in full-fledged, wide-scale, widespread testing by September 1.
Fantastic. So the big question on a lot of parents' minds right now is what is happening with schools? Schools are starting back in the next few weeks. We heard Washington Township's plans to stay virtual yesterday, but we're not really hearing anything firm yet from our own school districts. What role does the health department have in helping the schools with their plans?
So we help the schools review their plans and make recommendations based on what we see, and specifically our health educators dive into that. They have tremendous relationships in the school districts. They're in almost every school in the county multiple times a year. And I know they talk virtually daily with every school district trying to refine their plans. The hard thing is if we make a plan today, something changes tomorrow. So really, I know that at least Carmel, I think all of the school districts have sent out at least tentative plans to the families and, with a broad stroke of what they plan to do. But as we get closer and closer, I think we'll see them really refine that image and what that plan is going to look like based on the up to the minute information. But I think, the big thing to remember is the plan is only as good as what we know right now. And that, we may start after the first week of school and find out there's a problem with what they've done. We may have to adjust based on that. So the parents need to remain flexible and vigilant and, patient with the school districts. We're all ready to see the kids get back to their normal. for their benefit. But it's going to be the new status quo for everybody is the problem.
Well, speaking of back to school, immunizations are big this time of year. Have you seen parents be reluctant at all about taking their kids to the doctor for fear of COVID? And if they're interested in getting immunizations, can you tell us how they can go about getting that done?
Sure. I know a lot of programs put their immunization activities on hold due to COVID. I can tell you that we stopped for a significant amount of time. We have opened our immunization program back up at a limited capacity. We are doing immunizations 3 days a week. The best thing to do is to call our office, 317-776-8500, and see about scheduling an appointment. We would ask, if you do make the appointment, please make sure you keep the appointment. It is only one family member allowed in with the children for their immunizations at a time. That's to help reduce interactions in our facility. And anyone over the age of 2 is required to wear a mask while they're in our facility.
Awesome. Chris, anything else you want to add I didn't ask, or anything we need to think about in the week moving forward?
I think it's important to remember that, we don't wear our mask to protect ourselves. We're wearing that mask to keep our germs to ourselves. And, please be considerate of others, and, make sure you're maintaining that social distancing and wearing your mask when it's appropriate, please.
Chris Walker with the Hamilton County Health Department. Thank you, sir.
Thank you, ma'am.